Unit 7 test questions 151. A client who is being evaluated for thermal burn injury to the arm and legs complains of thirst and asks the nurse for a drink. Which action by the nurse is most appropriate? 1. Give the client small glasses of clear liquids. 2. Keep the client NPO. 3. Allow the client to have full liquids. 4. Order the client a full meal tray with extra liquids. The correct answer is 2. Keep the client NPO. 2. An industrial nurse is providing instruction to a group of employees about care to the client in the event of the chemical burn injury. The nurse instructs the employees that the immediate care is which of the following? 1. Leaving all cloths in place until the client is brought to the emergency room. 2. Removing all clothing including gloves and shoes. 3. Lavaging the skin with water and avoid brushing powder chemicals of the clothing to prevent further spread of the injury. 4. Determining the antidote for the chemical and placing the antidote on the burn site. The correct answer is 2. Removing all clothing including gloves and shoes. 53. A clinic nurse inspects the skin of a client suspected of having scabies. Which of the following assessment finding would the nurse note if this disorder were present? 1. The appearance of vesicles and pustules with a thicky honey colored crust. 2. The presence of white patches scattered about the trunk. 3. Multiple straight wavy thread-like lines bend the skin. 4. Patchy hair loss and round red macules with scales. The correct answer is 3. Multiple straight or wavy thread-like lines bend the skin. 54. A client has sustained a superficial skin tear to the arm. The nurse applies which of the following types of dressing? 1. Dry sterile dressing. 2. Wet to dry dressing. 3. Gel foam sponge dressing. 4. Semi-permeable film dressing. The correct answer is 4. Semi-permeable film dressing. 55. A home health nurse visits client suspected of having scabies. Which of the following precautions will the nurse institute during the assessment of a client? 1. Wear a mask and gloves. 2. Wear gloves only. 3. Wear a gown and gloves. 4. Avoid touching client's home furnishing. The correct answer is 3. Wear a gown and gloves. 56. A client with sustained an inhalation injury arrives in the emergency room. An assessment of the client, the nurse notes that the client is very confused and combative. The nurse determines that the client is experiencing which of the following? 1. Anxiety. 2. Fear. 3. Hypoxia. 4. Pain. The correct answer is 3. Hypoxia. 57. A client is an NPO status as nasogastric tube is placing after suffering bilateral burns to the legs. The nurse evaluates that the client gastrointestinal status is last satisfactory if which of the following is noted on assessment? 1. Gastric pH of 3. 2. Presence of hyperactive bowel sounds. 3. GI drainage that gastric narrative. 4. Absence of abdominal discomfort. The correct answer is 1. Gastric pH of 3. 58. A nurse inspects the oral cavity of a client with candidiasis. Which of the following would the nurse expect to note? 1. The presence of numerous small red pinpoint lesions. 2. The presence of blisters. 3. The presence of white patches. 4. The presence of purple colored patches. The correct answer is 3. The presence of white patches.